Hello everyone, my name is Dr. Rukesh. I'm consultant pediatrician and neonatologist from Paramita Hospital, Chandanagar branch. Today I am going to discuss about dengue fever and its related complications. So what is the cause of dengue fever? Why do children get dengue fever? So the main cause of dengue fever is caused by the virus which is known as dengue virus. So this virus is spread by mosquito which is called Aedes aegypti mosquito. This mosquito is especially seen in rainy season where there are water accumulations in nearby houses, and we see in overhead tanks and road pits. In that water accumulations, generally Aedes aegypti mosquito which is present, which spreads the dengue virus. So what are the symptoms of dengue virus? So first of all, the main symptom of dengue virus is high grade fever with chills and rigors, and which is associated with body pains and headache. And along with fever and body pains, the pediatric age group especially, they also experience stomach pain, vomitings and tiredness, and in rashes which are seen on the skin. And in some pediatric patients, we also see altered sensorium, seizures, loose motions and different complications. So when do parents should suspect their child is having a dengue fever? When the child is suffering from high fever with chills and rigors along with body pains and with fever which is not subsiding with medication, then every parent should suspect, especially in rainy season where we see a lot of dengue cases, then every patient should suspect their child may have dengue fever. So to confirm that, they have to take pediatrician advice. So what are the complications of dengue fever? So what are the complications of dengue fever? What we see in a regular hospital in season, we see a lot of pediatric patients with complications. So the common complications which are seen in dengue fever are tiredness and downfall in platelets, which is called thrombocytopenia. Platelets will be gradually decreasing in number, which may cause bleeding. Sometimes the bleeding will be more, and if medical attention is not given and if child is not treated early, the bleeding may cause life risk also. And hepatitis, which is called liver edema, so that is the cause, and with bleeding, and the child may go into shock also, which might have effect on kidneys. And finally, if fluid accumulation will be there in stomach and lungs, and which causes fall in the BP, and finally shock. And dengue fever may also spread to brain, which is called dengue encephalitis, and in which the child may have altered sensorium, seizures, and the child may need admission in ICU. So how to prevent? What are the precautions to be taken to spread of dengue fever? Especially every parent should know is, first of all, to prevent mosquito bites, especially when rainy season starts, when the mosquitoes increase in number and dengue fever cases are rise in the number, seasonal fevers are on the rise, then every parent should take care that mosquito bite is prevented for their children by using nets for windows and doors, by using mosquito repellents, by cleaning and by emptying the water-lodged pits nearby houses and overhead tanks so that mosquitoes cannot grow on them. So prevention of mosquito bite is the main step which should be done to prevent dengue fever. The child is having dengue fever, early attention and early hospital visit to pediatrician so that complications can be identified early and to prevent further increase in the disease. If the child is having fever, so what are the precautions to be taken at home? So at home, the fever should be controlled with paracetamol syrup as per doctor's advice, and hydration should be maintained, and symptom as per doctor's prescribed medication they should be used to the children. When should the child go to hospital? So if we see this, when the fever is not subsiding, when child is dull, when child is not taking orally anything, and when child is having rashes, and when there is a suspicion of bleeding, so their urine is becoming red color or in motion, the child may pass blood. So when there is a suspicion of bleeding, we should reach the hospital early and have timely treatment so that complications can be reduced. So when a child should be admitted in hospital in dengue fever? So especially when the child is not taking orally anything, when the child is looking tired, when there is a high fever which is not decreasing and platelets are falling below 1 lakh, baby is having persistent stomach pain. So these are the symptoms at which child should be kept in the hospital. so that early treatment reduces the complications in dengue fever. Can there be life risk in dengue? Yes, we have seen cases in which complicated dengue with shock, which are coming late to hospital, and dengue with encephalitis, with seizures. When dengue reaches the brain, it may be life-threatening in ICU, which needs ventilator care and treatment. So early treatment and prevention of mosquito bites are the main things which should be done in dengue fever, and no need to fear about dengue fever. Thank you.